living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
You probably grew up hearing drinking milk makes strong bones, and while that's at least partially true, there are actually a lot of things we can do to promote bone health no matter our age. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we're going to talk about the importance of bone health and how strong bones can help prevent injury and other health issues. Stay tuned, we'll be right back. Welcome back to Healthy Living for Life. Our bones actually play many roles. They help us move, they protect our organs from injury, they even release minerals into our body when we need them. So it is important to keep them healthy. And joining us this morning is Dr. Doug Kunzweiler, who's going to talk to us about bone health. So thanks so much for being here this morning, Dr. Kunzweiler.
Good to be here, thank you.
So we talk a lot, I feel like, about bones as we're growing up and building strong bones when we're kids, but why is bone health important as we get older?
Well, because bone is a living tissue. It's not inert like a piece of wood. It's constantly being repaired and constantly being worn down. And if we neglect bone health, there'll be more of the tearing down part, and our bones will become weaker and thinner and more fragile as we age. And then, of course, we're more susceptible to breaking our bones, and that leads to a lot of problems. So we have to take care of them just like any other organ in our body.
So let's talk about some of the things that can affect bone health. And let's start with calcium, because I think we've all heard that calcium is a big part of strong bones. But why is that? What does calcium do?
It's one of the main building blocks. If you think about calcium deposits around your sink area, you know, it's kind of a hard material. And calcium is one of the main building blocks. It helps to give that hardness to our bones.
So how much calcium do we need, and how can we get it?
Well, it depends on age to some extent. When we are younger and our bones are growing fast, we need more calcium, anywhere from 700 milligrams a day up to 1,300 milligrams a day, depending on your age. An adult still needs a fair amount, though, around 1,000 milligrams, and maybe even a little bit more if you have thin bones. So we need a fair amount of it. The main source is in dairy products, and it can be any dairy product: milk, cheese, ice cream, cream. Some people don't tolerate dairy products or don't like them very much, though. And there are other good dietary sources. Most green leafy vegetables are good sources of calcium. Kale, broccoli are good sources. And then the family of beans and nuts also are pretty good calcium sources. So there's a variety of places where we can get it from our diet.
Okay. And vitamin D is also important, as I understand. Can you explain why vitamin D is important, and what are some good sources of how we can get vitamin D into our diet?
Yeah, vitamin D is actually a hormone, which means it's a chemical messenger, and it does a couple of things. It helps our gut absorb calcium from the diet, and then it also helps that calcium get into the bone structure itself. There aren't a lot of great dietary sources of vitamin D. Most of our vitamin D comes from our skin. Our skin, when it is exposed to sunlight, manufactures vitamin D. So if we come from a climate, you know, where it's always warm and always sunny, usually we don't have any trouble with getting enough vitamin D. In the northern climates, where we're covered up a good part of the year, though it's quite possible to be low on vitamin D. And then most of the time you need a supplement.
So let's talk about caffeine. A lot of people start their day with coffee. I'm certainly one of them, and sodas also can have caffeine in them. But how does caffeine affect bone health?
Caffeine tends to diminish our ability to absorb the calcium that we take in our diet. 1 or 2 cups of coffee a day isn't really a big problem, but some of the soda beverages that have caffeine, colas, Mountain Dew and some of those that have a lot of caffeine in them and that people tend to drink a lot of during the day, they can interfere with calcium absorption. And if you're drinking a lot of soda with caffeine in it, it's quite possible that you would be low on calcium.
And let's talk about alcohol and tobacco as well and what those can do when it comes to our bones.
Yeah, those are our two favorites to pick on. Tobacco in any form weakens bones, particularly as we get older. So tobacco is not good at all for our bones. Alcohol, as long as it's in moderation, and by moderation, most people mean maybe 2 drinks, maybe 3 drinks a day if you're a male, doesn't seem to be a big problem. More than that, though, and alcohol also interferes with our body getting enough calcium.
Are there certain medications that can also have a negative effect on bones?
Yeah, probably the most prominent are the steroids, and these are medicines like prednisone, prednisolone, dexamethasone. These are medicines that are used primarily in things like asthma or allergies or some of the autoimmune diseases. If you're on those for long periods of time, they definitely reduce strength and mass, the quantity of your bones. So those are medicines that are hard on your bones. Some of the seizure medicines can have the same impact. Any medications that interfere with either estrogen or testosterone can interfere with bone health. And these are medicines that are used mostly in breast cancer or prostate cancer. So if you're on those, you should talk to your doctor about your bone health.
Okay. We have about half a minute left. Really quick, exercise. We know it's good for us. Why is it good for bones?
Well, when we do weight-bearing exercise, that is really what stimulates our cells to make more bone, to make new bone. So as I said in the beginning, bone is a living tissue, is constantly being remodeled. That means there are some cells that are breaking bone down, other cells that are adding new bone. It's a dynamic process. When you do weight-bearing exercise, that makes your body build more bone and make it stronger. So exercise is a key component.
Okay, perfect. All right, that was great timing. We need to pause here for a few commercials, but when we come back, we're going to talk about some of the other factors that can impact bone health, including gender. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. We're talking with Dr. Doug Kunzweiler this morning about bone health. And now we're going to switch and talk about some of the differences between genders. And it seems like most people know women tend to have more bone issues than men. Why is that? What's the difference between women's bones and men's bones?
Well, there are a couple of things. To begin with, women tend to have smaller frames, so they have smaller bones to begin with. And so they don't have as much leeway, is one way to think of it. Also, women go through menopause, and when they do that, there's a drastic drop in the amount of estrogen that their body makes. Estrogen is one of the hormones that helps to build bone. So when that goes away after menopause, then women tend to lose bone much faster than their male counterparts.
Okay. And so you mentioned estrogen and menopause. An estimated 10 million Americans actually have osteoporosis, and about 80% of those are women. So let's focus on that a little bit. What exactly is osteoporosis?
Osteoporosis is a medical term that really just means thin, weak bones. And it's the process whereby bone is being reabsorbed faster than it's being remade. And so you have a net loss, and that leads to weak, thin bones or osteoporosis.
And so a term we hear a lot is bone loss. What exactly is happening there?
So there are 2 types of cells that are involved in bone. One type, called osteoclasts, actually break bone down. Another type of cell, called osteoblasts, build bone up. So it's a dynamic process. And in osteoporosis, the cells that are breaking bone down get the upper hand, and they do it faster than the cells that are building it back up.
So what are some of the main causes of bone loss and osteoporosis?
Well, it's a process that happens naturally. As we grow as children, we have many more osteoblasts that are building bone up. That's how our skeletons grow. Somewhere in our early 30s, most of us kind of hit our maximum in terms of bone density or bone mass. After that, the cells that are building it up tend to sort of slow down, like a lot of other processes in our body.
Sure.
And the cells that are tearing bone down still keep working at it. And so after age 35 or so, you tend to slowly lose bone mass. So that's what's going on in the process.
Are there treatments for people who have osteoporosis?
There are simple things that can be done, such as taking extra calcium, extra vitamin D, doing weight-bearing exercises. And then in cases where bones are getting pretty fragile, there are medications that your provider can prescribe for you that will help build your bone back up and make it stronger. And there are a number of different classes of those medicines.
What can happen if osteoporosis goes untreated?
Well, ultimately what happens is your bones become very fragile and easy to break, and simple stumbling or simple falls that normally wouldn't cause trouble are likely to break bones, especially in the wrist, in the hip, and in the spine. And that's really a big problem for us.
And let's still go on the flip side of that and talk about prevention then. Can you prevent osteoporosis from happening?
You can, and the way you do that is by doing some of the things we've talked about. Eating a healthy diet, avoiding the things like alcohol and tobacco and soda drinks that tend to break bone down. But eating a healthy diet, taking calcium, vitamin D, doing weight-bearing exercise such as lifting weights or walking, things that stimulate bone growth. And then seeing your doctor and seeing if you need medication to help augment those things.
And so you mentioned seeing your doctor. At what point should you start talking to your doctor about bone health, and are there specific questions folks should be asking?
I think it depends on the person, but certainly if you're a female, you're at greater risk. If you have a family history of osteoporosis, some of this is genetic. You'll have a tendency towards it. So if you have a family history of osteoporosis, you should think about talking to your doctor early. If you have early menopause, that means age 45 or younger, then you should talk to your doctor, because if you lose that estrogen effect early on, there's a chance that you're going to get into trouble with osteoporosis. If you've had a fracture that seems like probably it shouldn't have happened, like a simple little fall and you break your wrist, then you should talk to your doctor and see about getting tested for osteoporosis.
And so is that a symptom of osteoporosis, broken bones, or are there other things people should be on the lookout for that should really indicate it's time to talk to a doctor?
No, unfortunately, osteoporosis doesn't cause any other symptoms other than broken bones. It doesn't cause pain, and it's not really noticeable unless you do an x-ray to measure the density of the bone. So it's sort of a sneaky disease. If you have risk factors, if you have a fracture, then you should talk to your doctor.
Okay, perfect. All right, we're going to pause here and take another break. But coming up next, arguably the biggest factor when it comes to bone health is age. And so we're going to talk about what you can do specifically as you get older to take care of your bones and try to keep them as strong as you can. Stay with us. We'll be right back after this. Welcome back. We're still talking with Dr. Doug Kunzweiler this morning about bone health and the importance of keeping your bones healthy. And so let's talk about age. We've touched on this a little bit, but how do our bones change just because of age?
Well, as I mentioned before, there's a dynamic balance between the bone being rebuilt and the bone being torn down. And as we age, unfortunately, the rebuilding part tends to lack a little bit. And so as we age, it's a normal part of aging for us to lose some of our bone mass. The bone building doesn't quite keep up.
So according to the Centers for Disease Control and Prevention, about 1 out of 4 people over the age of 65, or about 25% of people over the age of 65, fall. Is falling caused by weak bones?
No, that's not so much the case. It's caused by weak muscles. Most falls are a result of muscle weakness. Balance problems sometimes figure into this. But it's not so much the weak bones that are causing the fall. Now, when you do fall, weak bones fracture more easily, and so that's how you get into trouble.
And the most common fractures or broken bones are wrist, hip, or arm or ankle. And so I'm guessing if you break a bone when you're older, the healing factor, other things that can happen there, different than if you're a kid who falls off your bike and breaks a wrist or something. So can you talk about what happens with a broken bone and why it's more of a risk for older folks?
Well, the fractures in older folks tend to be more complicated because the bones are thinner, and instead of nice clean breaks, oftentimes they sort of shatter into lots of little pieces, which makes it more difficult for the orthopedist to repair. And then, because of what we talked about, that we don't build bone as well as we get older, it takes longer for the bone to heal, and sometimes it's not as strong as it would in a younger person.
So you've mentioned rebuilding bones. If someone has been diagnosed, they're seeing thinner bones, bone loss, or even diagnosed with osteoporosis, how do you go about rebuilding bone density?
Well, the good news is that you can actually make your bones stronger and more dense. And it's a combination of diet and weight-bearing exercise, and then sometimes help from medication as well. But you have to make sure you're getting adequate amounts of calcium, that you have an adequate amount of vitamin D, that you're not having a diet that has things that are working against you, like sodas, and then that you do active weight-bearing exercise at least 3 to 5 times a week. And that can be something as simple as walking. Lifting weights is good. Anything that puts a little bit of burden on your muscles and your skeleton will encourage the body to make more stronger bone.
How long does it typically take for someone to try to rebuild bone density?
Well, that's the bad news. So astronauts out there where there's no gravity don't have any stress at all on their bones, and they tend to lose a fair amount of bone density. So they've been studied, as you might expect, and it can take up to a year to gain back the bone that they lost from 6 or 8 months of being in zero gravity.
Wow.
Generally, it takes a couple of months of diet and exercise to begin getting some bone density back, but it can take up to a year to get back to a good, strong bone structure.
Are there tricks to speeding up that process, or it just is what it is?
Well, weight bearing is the real trick. Making sure that you have adequate diet, but you really need to put some stress on the bones, and that's the only thing that speeds it up. So a weightlifting program and an exercise program that involves weight bearing, like walking or jogging or something like that, that's really the secret to it.
Okay. We've talked about sodas, drinking, smoking, some of the things that people do that hurt bone health. Are there foods or other drinks that people who are trying to rebuild bone density should avoid?
Yeah, and basically it's just a healthy diet. First of all, you should avoid carbonated beverages. Even if they don't have caffeine in them, carbonated beverages have a tendency to make the body lose calcium. Alcohol, as we talked about, makes the body lose calcium if you don't do it in moderation. Processed foods generally are not as high in calcium as more organic, rough foods. So staying away from the highly processed foods also is helpful.
Okay, what about protein? Can you talk about the role that protein might play in trying to rebuild bone density?
Yes, about half of the structure of a bone is made up of protein. So protein is a very integral, important component to building strong bones. So it takes protein plus calcium and other minerals to make a good, strong bone.
And are there certain meats or places where we should be getting protein when we're trying to rebuild bone density?
Well, you want it to be good quality protein, and so avoiding some of the processed meats like bacon and some of the cured meats like that, all the ones that taste the best. Other than that, animal protein, plant-based protein is helpful as well, but you want to make sure that you're getting a complete protein diet.
Would you recommend supplements?
It depends. You should talk to your provider about that. It may be that, you're low in calcium and that a calcium supplement would be helpful. It may be that vitamin D would be helpful. Vitamin C and vitamin K are also important in bone health. But in general, if you are eating a good, healthy diet and you're staying away from those other negative things we talked about, supplements probably aren't really needed.
Okay. We're almost out of time. Any final tips about bone health?
Yeah, some people like to say that osteoporosis is a pediatric disease. And what they mean by that is you start to build healthy bone when you are young. So encouraging young people to eat a good, healthy diet that's high in calcium and that gives them adequate nutrients for bone, and then encouraging them to be active, to do weight-bearing play, weight-bearing exercise. That's how you avoid osteoporosis.
Okay, perfect. Thank you so much for your time and your information, Dr. Kunzweiler. As always, we appreciate it.
You're welcome.
And thank you so much for tuning in today. Come back and see us again next week. We're going to continue talking about bone health, specifically focusing on joints and arthritis. So we hope to see you here next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. See you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.